How can scoliosis potentially impact a pregnancy? Hi, I'm Dr. Chris Scoobles, and today I want to talk to you about how having scoliosis may or may not affect someone during pregnancy. So first of all, scoliosis is defined by a lateral bending of the spine of a minimum of 10 degrees with rotation. And today I'm going to talk to you about how having scoliosis could potentially impact someone during pregnancy. So some of the concerns for someone with scoliosis during pregnancy are how being pregnant could impact that curve. Specifically, during pregnancy, we know women are going to gain weight. How could that extra increase in weight potentially affect their scoliosis or back pain? Possible changes in posture with with pregnancy and added weight. Women are going to generally compensate with their posture to adapt for the increase of weight in their abdominal area. And then one of the big concerns is, can scoliosis progress during pregnancy? Because with pregnancy, you have a change in hormones, specifically an increase in relaxin, and that relaxin causes an increase in elasticity in your connective tissues, which we need during pregnancies to allow for normal delivery. So the first thing I want to address is that there is no evidence to show that having scoliosis can prevent someone from getting pregnant. And there's really no evidence to show that having scoliosis is directly related to complications with pregnancy, that women with scoliosis have normal pregnancies all the time. There was an article published in the European Spine Journal, and what the authors found is that women with scoliosis do tend to have slightly increased risk of having more back pain compared to someone that does not have scoliosis. Women with scoliosis also have an increased rate of null parity, meaning that they never end up getting pregnant. Now, we can't say that's a causation, it's more of a correlation, just that they're, women with scoliosis, for some reason, they don't have a higher percent of becoming pregnant at some point in their life, but we don't have any direct causation for that. Also, there is a slightly increased likelihood that women with scoliosis may suffer an increase in symptoms during and after the pregnancy. And it's possible that women with scoliosis may have a slight increase in their curve directly after their delivery or directly after being pregnant. But there's no evidence to show that that is a long-term side effect. So definitely, if you have scoliosis, it's a good idea to monitor your spine throughout the pregnancy. But as I mentioned earlier, that we know that women that have scoliosis do have a higher risk of having more and more severe back pain compared to normal populations that don't have scoliosis. What we also know is that women that partake in exercise before and during pregnancy tend to have lower levels of back pain during their pregnancy. So with that being said, if you know you have scoliosis and you are planning on becoming pregnant, the best thing to do is start to take care of your spine beforehand. And what I recommend is you find someone who's a specialist in scoliosis that is specifically trained and specializes in scoliosis-specific exercises. Schroth, Sees, or Scolibounce. Find one of those providers, get your spine evaluated, and then start doing scoliosis-specific exercises before you're pregnant, so that when you become pregnant, your spine is in a better shape. Now, to clarify scoliosis-specific exercises, there's a few ways these are different than general physical therapy exercises. One, we actually work to show a patient how to put their spine in a corrected position on their own. Once they are in the correct position, then we show them how to actually work on stabilizing that with stabilizing exercises. Then we also will show patients how to hold their spine in a corrected position when they're doing normal daily activities. And then the last part is there's a lot of education going on with that. So if you have scoliosis and you are planning on becoming pregnant, find someone who specializes in scoliosis-specific exercises, get evaluated, and start strengthening and stabilizing your spine, and ideally in a more corrected position before you become pregnant. Now, when someone is pregnant, there's a couple things that we do different, because even in adults, we'll do bracing when indicated, and sometimes we have them use orthotic devices to lay on. However, if someone's pregnant, we're not gonna have someone wearing a brace during their pregnancy, and we're not gonna have someone laying on an orthotic device like a Scolioroll during their pregnancy, but we're still gonna have them doing scoliosis-specific exercises. But there's something you need to understand. When someone becomes pregnant, especially when they get to about week 28, there is an increased risk of complications when women are laying on their back or lying supine. Because when it's lying supine, at that point in pregnancy, you risk putting pressure on your superior vena cava, which can decrease blood flow to your heart. And it's possible that the mother may redirect some of the blood going to her growing baby to help make up for that and make sure that she has normal blood pressure and blood flow. So it's okay to do some exercises while lying on your back, but you just don't want to do it for an extended period of time, probably no more than 5 to 10 minutes maximum. The good news is with scoli balance and most of our scoliosis-specific exercises, those are all done in a sitting or standing position. We generally only do things supine in the very beginning during a portion of the exercises when we're teaching them how to do things like rotational corrective breathing and things like that. So most of the exercises you're gonna do for scoliosis-specific exercise, you're gonna do sitting or standing, so they're totally fine to do during pregnancy. The other thing is, if during pregnancy you start to have major changes in your overall posture or balance, or you start to lean forward or lean back to compensate, then doing some specific exercises to bring your body back into balance can also have a really good positive impact on reducing back pain. Another concern though is just ergonomics and posture and positioning after you have your baby, because you're going to be doing things possibly like breastfeeding or holding your baby on one side or being in awkward positions. Let's say you have a left lumbar scoliosis and you're breastfeeding or holding a baby on your left side, you're putting a lot of extra pressure, that could potentially cause some pain or discomfort. So you're gonna have to be aware of still trying to do things symmetrically, and that's also where scoliosis-specific exercises, you can do those while you're doing things with your baby to help strengthen and stabilize your spine and help keep your spine in a more corrected position. Now, if you have a history of having a miscarriage after the first trimester, you want to be very cautious about doing weight-bearing activities, because when you have a miscarriage after the first trimester, then it's less likely to be due to the fetus and more likely to be due to something in your body, like with your cervix. So if you've had a miscarriage after the first trimester, then you're someone that's going to want to avoid doing weight-bearing exercises. Generally though, doing strengthening and endurance aerobic exercises do have a positive impact and decrease the chance of back pain for someone that's pregnant. The other thing I mentioned is after about week 28 of being pregnant, it's not a good idea to lay on your back for extended periods of times. So sleeping position becomes really important. You want to sleep on your side ideally. Now, some research has shown that whatever position someone falls asleep in, that's generally the position that they're going to be in the longest period of time. So before you fall asleep, it's good to position yourself on your side. That way you're more likely to spend more time laying on your side. And if you do wake up and you find yourself lying on your back, just go back to sleeping on your side. But no, whatever position you fall asleep in, you're likely to spend the most time in. So be conscious of trying to fall asleep on your side. Now, what about actual complications during the delivery? So there's no evidence to show that women that have scoliosis are more likely to have complications during delivery. There is some evidence that shows that women with scoliosis do have a slightly increased percentage of having C-sections. There is also evidence that shows that women with scoliosis may require more attempts to have a successful epidural injection, but overall in the end they are just as successful with getting an epidural injection. It just may require more attempts. Surgery, some people have concerns about what about my surgery during pregnancy, and the evidence in the scientific literature shows that if someone has surgery and they're pregnant, that they're not really at risk for having problems with those segments, with any of the instruments breaking, or with any of the areas where there's fusion. So women that have surgery can have a successful pregnant, just like someone that has scoliosis and who has not had a surgery. one specific article in the Journal of Bone Deformity and Spine Deformity found that women that had a spinal fusion during adolescence, when they compare those to women that had scoliosis and did not have a spinal fusion, those that had a spinal fusion during adolescence tend to have a higher likelihood of having a C-section compared to those that never had a fusion. But they were still able to have a successful pregnancy and delivery. So overall, I want you to know that if you have scoliosis, you are just as likely to become pregnant and have a successful pregnancy and delivery as someone who doesn't have scoliosis. But be proactive. If you know that you are planning on becoming pregnant, or you just found out you are pregnant, definitely go and get evaluated by someone that specializes in scoliosis-specific exercises, because it's a good idea to start strengthening and stabilizing your spine before pregnancy, or definitely at the first few weeks of pregnancy. And then after you're pregnant, make sure you get reevaluated to see what strengthening and stabilizing exercises that maybe you need to do afterwards. But the good news is that if you have scoliosis, you have a very high likelihood of having a successful pregnancy.